Welcome into the Psych with Mike Library. This is Dr. Michael Mahan, and I am here with my good friend and colleague, Mr. Brett Newcomb.
Good morning. Welcome back.
Thank you. So you are wishing me a welcome back because I have been traveling. If anybody follows the Psych with Mike page, then you may have seen that I had posted some pictures recently. My wife and I had visited Jamaica, and we had spent a week there without our children for the first time, and so that was a fantastic experience that I enjoyed tremendously.
It's an awesome experience, especially being on the beach.
Yeah. Well, you and your wife have been traveling pretty consistently over the last couple of years because
I'm retired.
Yeah. And so I think that you believe very much in this idea of travel and replenishment.
Well, I've always believed that travel is broadening.
Yeah.
You learn new things. You have new experiences that you have to process and handle. You meet new people with different stories. You see things that have merit and value that you don't see in your everyday life. So I think travel is broadening and makes you a fuller person. Mm-hmm. But I also think it's healing. It can be healing in that the anxieties and pressures that you focus on in your everyday life recede into the background. Mm-hmm. Because you're, and it's, to carry it to an extreme, it's like they say in AA when they talk about the geographical cure.
Yeah.
If you're going to cure yourself from all your problems and addictions, if you just go somewhere else to start over, nobody will know you. There won't be any reputation or history to follow you. Problem is, in your back pocket is you. And
right.
So wherever you go, there you are.
Right. Right.
But I do think that there are incredible psychic and healing benefits from the opportunity to travel if you will learn to allow them to exist. Mm-hmm. If you'll put yourself in a situation to possibly encounter them and to experience them.
And I agree 100% with that. And so what we kind of wanted to talk about in this episode was this idea of psychological flexibility and how you are able to engender that as a person, and what is the importance of that. And for you and I both, I think we both agree that travel is a really life-enhancing part of that.
I do. I absolutely do. We talk about the pressures that we feel. Many of us in American society today lead lives that are highly stressed. Mm-hmm. And we become obsessed and narrowly focused with those stressors, whatever they are in our lives. And I think we live in a culture and a technology world that entreats us to expect and pursue immediate gratification, immediate resolution of any difficulty or any problem. Mm-hmm. And I think that's a mistake, because I think if you have time to let it stew around in the background, the essential elements will surface and the chaff will fall away. Mm-hmm. And if we don't stop and allow that to happen, then our search for immediacy complicates our life even further. Mm-hmm.
And for me, I've been thinking about this since I got back, and what's really been persistent on my mind is this idea of creativity and the need for creativity in a person's life and how you manifest that. So, you can think of creativity as painting or playing a musical instrument, or even having a hobby like playing golf or something like that. All of those things we've heard forever are life enhancing. But for me, I do a lot of things, and there's a lot of real constraints on my time. And one of the ways in which I have an opportunity to experience that creativity process is when I travel. So you don't have to travel to have that as a part of your life, but for some of us, that is one of the ways that we get to experience that.
Well, but what we're saying is that the travel is not the key ingredient.
That's right.
It's the process by which you experience travel.
Right.
And that's a process. I mean, we've talked in the last number of weeks on our podcast about meditation, mm-hmm. and about getting centered and using self-hypnosis or relaxing or whatever helps us divert our attention from the pursuit of the next immediate payoff that allows us to just be and to experience something. And for me, at least, because I used to be a workaholic, finding a new environment where those workaholic tools were not immediately available allows me then to breathe more deeply, to look more carefully, to experience more immediately where I am and what's going on. So it's a great thing.
Damn duck.
You know, he comes with me every week. I don't know what he's doing. Yeah.
He's in your back pocket.
Yeah.
And I think probably everybody can identify with that idea of either workaholism or just something that a person finds in their lives that they focus on that they recognize isn't probably life enhancing for them, but that they can't stop.
Well, and again, it's not about travel. I
Right.
recognize that now that I'm not primarily focused on work, the next project, the next job, the next promotion, the next paycheck, then I have time to experience more in my regular environment the things that we're talking about. And I mean, for instance, today in St. Louis, Missouri is an incredibly beautiful day. To be sitting outside in the backyard and watching the world go by from the backyard with a book in my lap or music playing softly in the background, those are immediate moment experiences that are enriched with color and feeling.
But I think that a lot of people would say to themselves, but if I am doing that, I'm wasting time.
Yeah.
And that's the thing for me that I just want to shake people and say, that's actually not wasted time. That's actually invested time.
Right.
You need that in your life to be able to maintain balance, to be able to be psychologically flexible. I have a really, really busy schedule, but you and I go skiing at least once a year, and then I go usually on a vacation with my wife once a year, and I really value those times. I don't want to give that up. I could have spent this time that I went to Jamaica doing other things. I could have seen clients and done all kinds of other things that would have been productive, but wouldn't have been as life enhancing for me.
Because you would have been doing rather than being.
And that's a great point, which we've talked about in the past, this idea of the difference between doing and being. And, when we go on ski vacations, or I go with my wife and do, what I did just recently in Jamaica, where I got a certification in deep diving, and those things are situations that are different than what I'm doing every day living in St. Louis.
You also go to a totally alien environment.
Right.
You snorkel and scuba dive. But when you get down in the ocean, you are surrounded or removed from you're surrounded by a new environment because you're removed from the existing environment where you spend your life.
Well, and even in it more than that, for me, the reason why scuba diving is so great, or why skiing is so great, so just for self-disclosure, there's no reason for anybody to know this, but neither you or I ski with headphones in.
Yeah.
And you laugh, but there's a lot of people who do, and I'm not saying you shouldn't do that.
I also don't drive with headphones on.
Yeah. But we enjoy the process of being in that environment, in nature, and hearing the sounds that are naturally a part of that experience. And when you go underwater, you only have the sound of your own breathing through your regulator. And there isn't anything else to distract you. You're not having a conversation with the guy next to you because you can't talk to them underwater. You can have hand signals, but for the most part, you're immersed in an experience where you are as close to one-to-one with your environment as I usually get when I go skiing or when I go scuba diving. And so you don't have to travel to do that. You can do that in your backyard. You can do that through mindfulness anywhere that you are.
You also can go to a location where they have sensory deprivation tanks, or floating tanks,
which is a big thing now.
Yeah, it's a big thing, and what it does is intentionally isolate your consciousness from immediate sensory input. So, I mean, I've read some stories about how one of the first waves of experience that you have when you separate from sensual input is all of the things in your unconscious that generate anxiety or fear. You start to hear or see in your mind's eye says, oh, there's a snake, there's a rat in the wall, and you hear him scratching you here, and people have terrifying experiences. And if they can get past that, then they start to find a peacefulness and an expansiveness that they don't know what to do with, because their lives don't allow that. So
initially, then, what I'm hearing you say is that initially, when you allow yourself to quiet your mind, you initially might experience some anxiety because those anxieties are going to float to the surface.
Right.
But
and
if
we
you can
soothe
stay
our
with it long
anxieties
enough,
by doing our habitual activities.
right, by distracting yourself.
Yeah. And the distraction is a required focus. So if I take on a job or a task for a job, I have to write a paper by Monday, and I sit down and start to write the paper, then those elements of myself are not getting any attention. But if I remove all of that distractibility, then, and especially from sensory input, I'm not hearing the police siren go down the road, I'm not hearing somebody knock on the door or some TV in the background, I'm not feeling anything essentially with my receptors, then my subconscious starts to give me sensations that it is attending to, and at the very surface level, those tend to be anxiety provoking.
Right. So you have to stay with it long enough to get through that place.
That is my understanding.
Yeah.
I haven't done this because I'm afraid of what I'm afraid of.
Well, I remember when my first exposure to sensory deprivation was at St. Louis University back in the 80s, and the sensory deprivation tank that they had back then was essentially a sarcophagus in a dark basement room. And it was not an experience that you probably would enjoy
I remember getting an MRI, and they put you on this slab, and they put headphones on you and give you music, they talk to you and stuff, in part to distract you from the experience, because when they slide you into that tube, you're laying flat on your back and you're surrounded by a metal roof that's maybe 3 inches above your nose, looking at it. And I know my mother-in-law is terrified by she's claustrophobic and she's really hard. I wasn't concerned about it, and I was laying there and processing the experience. And she asked me, she said, what were you thinking about? You know, you're laying there with your hands crossed on your chest and your face is looking at a metal roof 2-3 inches above your nose. You can't move or say anything. You just wait for them to finish. I said, I was thinking that this is what it's going to be like in a casket.
Yeah.
You know, and she said, I hate you. I hate you. Because it terrifies her. Yeah. But so if you have those fears, they've even developed open MRIs now for people that have that anxiety saturation that doesn't let them complete the test.
So we can go skiing and spend, a week skiing on a mountain, and we can get away from the everyday grind of our lives and have this kind of experience. We can go to the beach and we can go diving and go under the water and be very separate from the everyday trials and tribulations of the world. But not everybody can do those things. So for people who aren't able to go away, then we have things like breathing exercises.
Right.
We have mindfulness exercises. We have the meditation that essentially is the same kind of experience, but it requires a certain amount of dedication and practice.
And training.
Yeah.
Because even the technique of thought stopping, people that are obsessed and having panic attacks about particular anxieties, I try to work with them about thought stopping. When you recognize that that's intruding into your consciousness, like you're just supposed to sit for 5 minutes and breathe and focus on your breathing, and then your mind starts saying, hey, wait a minute, what about this? You got to do this today. And did you get that phone call? And pack your lunch. Are your kids up? Are they gone? You have to say, stop, shut that down, and refocus on your breathing. And within milliseconds, some other thought's going to race into your mind and say, we don't have time for this right now because we have to do this and that and the other. So you have to teach yourself to control that.
Right.
And you can. It is learnable.
Right.
But
so when I work with clients on that very, very specific issue, what I tell people is that you have to find a distraction technique that is at least as emotionally intense as whatever you're focused on. And so what I try and recommend is that they find what they would consider the most emotionally intense distraction, so that way you don't have to think about, okay, well, this is how emotionally intensive this oppressive thought is.
You think it has to be something in all caps instead of just a baseline neutrality?
No. I don't think. No. What I'm saying is that if you want to apply the technique universally, then what I want people to do is to come up with the most emotionally intense distraction that they can think of, because they can apply that then in all situations. They don't have to think about, I need something that is this emotionally intense. So, for example, when I first started doing this for myself, what I started to think about, I was actually in graduate school, and I started to think about, we were studying rational emotive therapy, and I thought, okay, if I were going to apply this to my life, how would I do that? And I thought, okay, I need something, and the way that I applied it was actually driving. I would get so angry on the road, and I'm not saying that I got tons better immediately. It was a long process.
I have ridden with you recently, so.
And I don't get angry anymore.
Not in the same way?
Not in the same way. Yeah. And so what I thought about was, what could I use as a distraction technique that would get me re-centered? And I needed something that was going to be pretty overwhelming and pretty immediate. And so for me, what I used was Luke Skywalker's theme in Star Wars. So if you think about Star Wars, if you think about Star Wars A New Hope, after he's had the fight with his Uncle Owen and Aunt Beru, and he knows he's not going away to the Imperial Academy, and before R2-D2 runs away, he goes out onto the surface of Tatooine, and the twin suns are setting, and the music that's playing in the background during that sequence is Luke Skywalker's theme. And that's my favorite piece of music in Star Wars. And what I would do would be to hum that to myself. And the minute that I do that, I am a 13-year-old kid sitting in a theater in 1977 watching Star Wars. And that is such an emotionally overwhelming experience that it floods everything else out. Now, I can go right back, just like you said. Once I do that, I can go right back to feeding that negative thought back into my mind. And then I do that humming of the Star Wars theme again, but it gives me now control over whether or not I want to continue to engage in that negative thought process or do something different. And I think that we have to be able to do that. You first have to, like you said, stop the negative intrusive thought, and then you can choose to do your deep breathing or choose to do your meditation, whatever it is, to get you back into a mindful set.
So as you do that repetitively, do you have to turn the volume up?
Well, I don't, because
or do you just play it at full blast anyway?
I played it full blast anyway, but because that's so emotionally intense for me, and so if everybody has something.
Well, and when we hypnotize people, and we know that we're going to hypnotize them repetitively, in order to save time, we sometimes give them a code word, so that we get them in the place and the safe environment, and then we say, code blue, and they immediately go into a trance at a depth where we can do the work that we need to do.
So through repeated application, then you have that expectation. Okay, as soon as I start humming Star Wars to myself, I'm going to immediately be in that more calm, relaxed state. Yes, absolutely.
Well, that makes sense. Yeah. Because I've seen that, and I've read. I haven't seen this experience, but I have read that people undergoing certain medical procedures where they don't have anesthetics available, delivering babies, for instance, or having your teeth worked on or what have you, sometimes get trained with repetitive hypnosis so that the hypnotist can put them in a trance so that their body doesn't experience that pain of the delivery or the surgery or what have you. So, I mean, it's amazing what our minds can do.
Yeah. When I was going through my training, that was actually one of the things that the people who were running the program talked about a lot, is people who are, for example, recovering or have a reaction to certain kinds of anesthetic, that hypnosis can be used as a surrogate or an adjunct, so they don't have to take as much medicine or don't have to take medicine at all in exactly those situations. Well, it's been proven to be very effective.
We have a colleague that we both worked with who had a client that suffered from and many years ago, it was called multiple personality disorder. Now it's called dissociative identity disorder. And that client and her dentist requested that our colleague come to the dental treatment session and keep them under hypnosis so that the work could be done, because when they would put them under the drug, the personalities would switch and the drug wouldn't be effective, and they would bleed or have pain.
Yeah.
And they were able to, under hypnosis, say, okay, we got a little too much bleeding here, you need to slow it down, you need to stop it, and it would stop.
Wow.
Or would it say, just you can feel the pressure, but you're not going to feel the pain.
Right.
And that was helpful, and that person was able to get critical work done for their teeth.
The unconscious is
it's
amazing.
Yeah.
It's absolutely amazing.
And I knew that unconsciously.
Yeah.
Yeah.
So hopefully that has been a good discussion for people. Just to do a couple of housekeeping things, remember that the podcast lives at psychwithmike.com, but we are also available on YouTube. So if you want to go to YouTube and watch a video of the show, you can do that. If you do so, please like the videos and subscribe to the channel. That really helps us out. And we are looking for people to give us feedback. We're also looking for people who would like to be participants to the show. So if you've been trained by one of us, if you've been a student of ours, or if you just are somebody who has an interest or a topic that you would like to discuss, please get in touch with us. And you can do that through the website, psychwithmike.com. You can shoot us an email. And remember, if it's Friday, it's Psych with Mike.